Do people ever tell you you look tired, even when you've slept well, you're eating clean, and you feel totally fine, well rested, and full of energy? This is literally one of the most common frustrations I hear about. And the truth is, it has very little to do with sleep. So in this video, I'm going to explain why your face looks tired even though you're actually not, and also what's happening under the skin that's causing this and what you can actually do to fix it. If you're new here, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon with over 20 years of experience helping people look as young as they feel through natural surgical rejuvenation as well as clinically backed skincare. We're gonna break down what actually causes aging and fatigue in the face from a scientific standpoint. And if this is something that you care about and subjects like this, make sure you hit subscribe so you don't miss out on the conversations. So when you look in the mirror and you look like you feel tired, or even worse, when somebody tells you, hey, are you feeling tired or you look tired? What they're responding to is visual cues. And those visual cues usually come down to darkness under the eyes, which can be perpetuated by hollowing, deflation in the cheeks, as well as a dullness to the skin, and sometimes even a downturn in the shape of the eyes, and the downturn of the mouth. All these things contribute to leaving us looking tired. And I want to talk to you about how these things contribute to the tired overall look. This is ultimately never a good thing, because when people look at us and we appear tired, there's connotations and there's an impression that you're making, and it's not a good one, right? In the workplace, you don't want to look tired because you clearly don't look like you've got the energy or the robust sort of nature to perform well. And that might have an impact on how you're perceived and your aptitude and your ability to get work done, etc. And I'm going to share with you a very, very interesting story that stuck with me for literally almost 20 years now. Almost 20 years ago, a San Diego Chargers linebacker came in to see me. 24-year-old guy, year or two out of college. I think it's like second out of third year of his contract. And this kid had genetic features that made him look really tired. He had puffy bags under his eyes. He had hollows under his eyes. And the impression was, this kid looks tired. He was worried because his coaches at various points in time have pointed out that he looked tired. And he was worried because as a young professional athlete, he did not want to give the impression that he's out partying at nights, burning the candle on both ends, and that he's not dedicating himself to being the best football player he can be. And his contract was coming up. So he came to me actually to evaluate, but also to treat this condition. And in his case, it was completely genetic. Puffiness under the eyes, and some people can start as early as the 20s. And hollowness, same thing, fat loss, volume loss, contributing to that. So we performed a lower eyelid blepharoplasty and a very limited fat transfer. I mean, this guy was truly an athlete, very little fat on his body, but enough just to treat the lower eyelids. And immediately he came out looking so much more refreshed. And you can see that in some of the examples here, how bright and fresh the face looks just from treatment with volume or treatment with volume and lower eyelid procedures. So it doesn't always require that, but this is just, pointing out that it's not just a aging problem. And so if you're watching this or somebody who has this condition, you might want to send this video along to help them understand it. But there's definitely a continuum that occurs as we age that makes us look tired. And we're going to go through that one by one so that you can kind of understand the effects. And then for each of those, we'll talk about the treatments. All right, so here is the real reasons why you look tired, even when you're not. So as mentioned above, one is under eye hollowing. And so what happens is we age, or because of genetics, there's a fat pad that surrounds the lower eyelid bone, the orbital rim, and also around the upper lid, but really it's the lower lid that becomes problematic. When it hollows or you lose that, what you end up seeing is a tear trough deformity that leaves the eye with shadows and contours and an elongation, a kind of a longer look. This distance between the eyelid and the cheek gets longer in addition to the shadows that are formed, and this makes the face look quite tired. In that same continuum, there's mid-face volume loss that happens. Now, it's a little bit of a misnomer because the mid-face is this upper cheek region. You can definitely lose volume, where I see it in, again, 20, 30-year-olds just genetically. My wife was in her early 30s when she lost a bunch of volume in her cheeks as a result of pregnancy, etc. So it's not, again, not totally related to age, but it's predictably related to aging as well. So if you're in your late 40s and 50s, you're going to see this no matter what. But what ends up happening is the cheeks begin to flatten. Some of it is from volume loss if you're younger, but if you're older, late 40s and 50s, what's actually happening is not just volume loss, or maybe even not as much volume loss in the cheek, but it's the descent of the cheek. As the cheek begins to come down, this area empties out and you end up looking quite gaunt and tired. So that sunken look, that loss of support around the eyes and cheek, is related to mid-face volume loss and descent. Now, another very, very important part of looking fresh is the skin quality, right? So skin quality declines. Remember, in a lot of the different videos we've talked about this. Starting in our mid-20s, we begin to see skin quality decline, and the pace of which gets worse and worse year after year. So what's happening? The skin is thinning due to collagen loss. It's getting dehydrated because of a decrease in production of hyaluronic acid and more exchange and basically evaporation of water through the skin. Skin gets dehydrated. The skin also becomes uneven in terms of its discoloration, which then causes the skin to have differences in the way the light reflects. So, and I should mention one more part of that, which is a thickening of the top dermis of the skin, the upper part of the skin. It's called the stratum corneum, which doesn't allow the light to bounce off the skin. And when it can't bounce off the skin looks dull. That dullness, and contributed from all the different things that we talked about here, the turgor of it, the discoloration of it, the dehydration of it, the thickening of the stratum corneum, all makes the skin and face look dull and fatigued. Now, looking inward, there's also things that are happening. The skin is the largest organ in the body, so it reflects what is actually happening inside of our body. So if there's chronic inflammation, poor diet, a lot of alcohol, smoking, stress, sun, poor recovery, inconsistent use of good quality skincare, absolutely it can lead to an expression of skin and face that looks tired. That's a lot of reasons, and none of them are directly related to a lack of sleep. Now, let me back up for a second. You can have 1 or 2 nights of bad sleep, and you're gonna look very, very tired. There's no question about that. So it's not that sleeping is not related to it, but once you catch up on your sleep, you would expect to look a little bit better. These things that we're talking about here are more persistent and more permanent changes that make you look tired, no matter how well you sleep. That's the caveat here. No matter how well you sleep, you're still gonna look tired because of the things that we just mentioned. So why don't eye creams alone fix the problem? This is where people get understandably frustrated, right? So their eyes look tired, they're dark, etc. So they're thinking, okay, what solution should I look for? Well, okay, the obvious solution is go out and buy an eye cream. A lot of these things, have terms that are related to improving the darkness of the lower eyes, repair this, repair that, rejuvenate this, etc. So they buy eye cream after eye cream, but the tired look doesn't change, it doesn't go away. And that's because most of the problem, as we mentioned, isn't just the skin, it's the structure, the volume, the cellular health of the structure. So bottom line is eye creams alone aren't going to correct the problem. So right there just saved you a lot of time, energy, and money searching for eye creams that are going to sort out this problem. That's not going to help you. Fixing a tired face requires a systematic evaluation of the problem. And I helped you with the diagnostic aspect of it. We're going to do that again here. And then a layered approach, very systematic, practical approach of addressing each one of those things if they're indeed the problem. So let's think of it in terms of layers. So layer number 1, skin health, right? I consider it the foundation because no matter what age you are, if your skin doesn't look healthy, vibrant, supple, you don't have that beautiful glow, you're going to look tired, right? So this is where consistent, clinically active skincare matters. And what I mean by that is, it's not just about moisturizers. It's not just about exfoliating or putting on some, toner, etc. This is about using those actives that we've talked so much about on this channel, things like retinol for cell turnover, vitamin C for brightness, niacinamide for inflammation and barrier control, peptides for collagen support. This is exactly why I developed the Karam MD trifecta. And for those of you who want to learn a little bit more about it, it's a super, super effective, super simple way of checking this box off and making sure your skin is looking its absolute best at any age. Learn more about it on the website, karammdskin.com. Layer number 2, support collagen and circulation. This is where lifestyle matters, right? These are kind of like the starting points of all of this stuff. These are the things that you control and you control on a daily basis. So get plenty of sleep. We all know what that is, 6 to 8 hours. Get hydrated, protected from the sun. And honestly, you can also probably throw in some exfoliation into that mix, especially if you're a little bit older, to get rid of some of those dead cells that we talked about. Although a good skincare program like the trifecta will also exfoliate some of that skin and help brighten the skin as well. But if you're not doing that directly, you can also do things like, chemical peel, at-home exfoliation like the polish that we have as part of the Karam MD line. These things are done to remove that dead layer of skin that we talked about. Now, let's talk about layer 3, which is the structural correction. When needed. Again, it's not always needed, especially in the younger phases. And sometimes there's not that much needed. For example, if you have a little bit of a tear trough, your eyes are just a little bit hollow, the answer is going to be just put a little bit of volume back into the area. So a little bit of filler goes a long way. Now, if you have a lot of volume loss and the eyes are really, really tired, well, then probably a fat transfer would be better because eyes can't tolerate that much filler underneath them. So something like fat transfer would be a better choice there. The tired look that we're talking about, if it's coming from volume loss or descent, the important point here is that no cream is going to fix it. The Karam MD trifecta is not going to fix the structural problems. No miracle cream is going to address it. That's where structural rejuvenation, like fat transfer, eye rejuvenation with like a lower blepharoplasty or a skin pinch, or even, frankly, if the midface is coming down, everything needs to be lifted. That's where things like a facelift, like the vertical restore, deep plane facelifts, etc., make the biggest difference. So you got to understand what is causing it. So if, again, quick review, if it's minor volume loss, a little bit of filler can help you. More volume loss, but no sagging, there you go with a little fat transfer, you're golden. If it's descent, midface is dropping, face is coming down, or you have bags under your eyes, you're going to need surgery. Blepharoplasty to remove the bags, lift the midface up to improve the eyelid cheek junction, also get the cheek back up. So it's important to know this so that you don't get misled into different things thinking that these things are going to correct it when they won't. All right? If this is all helpful for you so far, take a second, please, and subscribe. We go deep into these topics every week, and I want you to have the full roadmap, not just a quick tips, okay? Let's talk about some final thoughts. Looking tired isn't a personal failure, right? It's not always in your control. Some aspects of it are. It's not something that more sleep alone is going to fix. So don't get frustrated when you go out and try to sleep a lot and wake up the next day and you're still looking tired. It's your face telling a story about its volume status, its skin quality, and its shape. Once you understand that, the solution becomes clear and achievable, and you don't end up wasting. Again, I'm very sensitive to people wasting time, money, and energy and ending up being disappointed by going down these dead-end problem solution sort of pathways, right? This is helping you stay clear and focused. If you want to start where it matters the most, check out the Karam MD trifecta. It's the same foundation I recommend to every patient. The link is below. You'll check it out to see for yourself. Easy and effective, right? So that checks off your skin box. The other aspects we talked about, volume, this and that, make sure you're in the hands of a good provider. Super important, because how it's done, the delicacy of it, not overdoing it, etc., can have a huge impact in leaving you looking natural, refreshed, less tired without looking like you've had anything done. So take the time to identify a good practitioner wherever you are in the country or outside the US, etc. If you're going to go down the addressing the structural aspects, the need for a high quality experienced provider is always, always essential. So another thing I think it's really important for you all to do, especially if you're interested in this type of topics, is to sign up for the Karam MD Journal. This is a weekly newsletter, and it gets into more depth and more topics, etc., on facial rejuvenation, skin rejuvenation, and education. It's a totally free resource, and I think it'll be very, very useful for you to be a part of it. And if you're thinking about facial rejuvenation and you want to learn a little bit more about how it can be done naturally, make sure you check out drkaram.com, look at some of the vertical restore outcomes and eye rejuvenation outcomes, and make sure, once again, you don't forget to subscribe to this channel and send this along to some friends and family. You know, I'm here to help you look as young as you feel. Thanks so much for tuning in. Until next time, Dr. Amir Karam.